to today's session. Myself Rajita, and in this session we are going to discuss regarding a very interesting and important topic of medical surgical nursing. So I hope in the previous session we have already learned regarding the role of a nurse in our outpatient department. So in that session we have learned regarding how the outpatient department works. So what are the basic functions of outpatient department and what are the objectives of it, as well as we have seen different major roles and responsibilities of the nurses working in outpatient department. Now in today's session, we are going to learn regarding role and responsibilities of a nurse in inpatient department. So first, here let us have some discussion regarding how the inpatient department works and what it is basically within a healthcare facility. So, inpatient department is a specific facility located within a healthcare setup or within a hospital, which will be providing medical care to those patients who need a continuous hospital stay and a continuous medical monitoring and treatment. So basically, in simple term, we can say, as we have seen in outpatient department, where generally person or the general population, the person will be coming from there to the outpatient department in order to seek medical treatment. But outpatient department doesn't require a person to be admitted or have a longer stay within the hospital in order to provide the medical care effectively. But in case of some patient who generally requires or genuinely requires a continuous medical monitoring and treatment, for them it is very important to ensure a proper hospital stay. Now, inpatient department are those specialized ward where we're going to see the clients will be getting admitted for a longer stay to seek the medical care as needed. So as we have learned regarding what is inpatient department, I hope you have got an idea how it will be working. So here we are going to discuss again what are the basic functions of inpatient department within a hospital setup. So it is the major function of our inpatient department within a healthcare facility is to provide a highest quality of medical and nursing care. So you need to get the idea that the people who are seeking the medical care and approaching to the hospital setup does require a very deep and continuous medical attention. Even they will be requiring nursing care and nursing support in order to promote their health or cure their disease. So inpatient department have the major function to provide a highest quality of medical and nursing care to the patient who are seeking it. The second major function of inpatient department is to make a provision to have equipped with highest quality equipment, and also they ensure a proper usage of drugs and other materials or equipments or other medical procedures in order to manage the client with their disease condition. So definitely in inpatient department, as we're going to see, the patient will be admitted there and they will be coming under a continuous medical attention or medical monitoring. Now we are also going to see that many equipments and drugs will be used for the client in order to treat their disease condition. So for example, if a client is having hemodynamically instability, we often see the client will be shifted to intensive care unit, which is a specialized type of inpatient department which also provides lots of equipments, for example ventilators and so on, which will be ultimately helping the client in order to support their health status and improve the condition of their health. So that is how we are going to see the inpatient department will be facilitated with medical equipments, many kind of drugs, even certain medical staff which will be performing various medical procedure to manage the client suffering from certain disease. So the next function of inpatient department includes to provide a very comfortable and desirable environment to the client, which will also work as a substitution of the home in order to promote their curative aspect of health. So we're going to see here that basically inpatient department for a time duration it will be providing a substitution of the homely environment so that a patient can heal fast from their suffering. So that is the third and major and most important function of inpatient department, which also will be ensuring early discharge of a patient by providing a highest quality of medical and nursing care to reduce their suffering. So the next function of inpatient department also includes providing a very suitable environment in order to promote the healing, as I have mentioned before. So it ensures that the hospital facility are equipped with all the necessities for the client to promote their healing. That is the reason we are going to see there will be infection control protocols. There will be certain protocols and standardized process through which the procedures or medical procedures and nursing procedures would be performed by medical professionals for the client in order to manage their health condition. That is how it will be creating a very suitable and desirable environment through which a person can promote their health. Now, the next function is, although it is not directly related to the patient care, but it is also one of the most important function of inpatient department, that it's provide the opportunity to the medical professionals for education, research, as well as training. So as we know, maximum time the medical professionals, basically the trainees or the students, will be working in inpatient department in order to provide the care under the supervision of the senior staff. That is how inpatient department also will be providing a facility where education, research activity and training activity of the budding medical professionals can be done. So it is also considered to be one of the most important function of inpatient department. So I hope here now you have got an idea how the inpatient department will be working. Now we are going to learn regarding what are the major role and responsibilities of the nurses in inpatient department. So first and foremost important nursing responsibility within an inpatient department includes providing effective patient care. Now, this includes various steps which will be performed by a nurse since a client is getting admitted to the hospital setup to meet or to seek medical care. Now, it generally starts with assisting the client for the admission procedure. So, whenever a client is approaching directly to an inpatient department, or maybe shifted from a different hospital setup, or maybe referred from a outpatient department for a hospital stay and continuous medical monitoring, we're going to see nurses plays the major important role here to assist the client and their family member to complete the admission procedure. So, as I have mentioned, it is a very important role of a nurse to learn about the standardized. So now, as I have mentioned, it is a very important role of a nurse to learn regarding the standardized protocols and procedures related to the admission of a client within hospital setup, which definitely will be varying from different healthcare facility to the another one. So it is a very important role of us to learn regarding the admission procedure in details, as it helps us to collect the accurate data related to the patient and their admission procedure within the hospital setting. The next role of the nurse here in patient care includes performing a history collection or performing a thorough history collection from the client or their family member, as well as performing a physical examination. Now, it is a very important role of a nurse to perform history collection and physical examination to or for the client who are newly getting admitted to the inpatient department. So even we are going to see after a certain duration, a nurse would be redoing the history collection and physical examination for the client in order to make sure or in order to find out their medical needs. So that's how the history collection and physical examination at the beginning of the admission, even at a certain duration, should be performed by a nurse. So definitely here, nurse plays a very important role to maintain the data which are being collected from the client while doing the history collection. Even family member would be involved in this procedure of history collection to make sure that the data which are being collected from the client is accurate and sufficient enough. Also, the physical examination will be helping the nurse to identify the priority medical need of the client, which will be ultimately helping a nurse, even the other medical professionals, to manage or to make a plan of treatment for the particular client who just got admitted in an inpatient department. So, as we have learned, the second major role of a nurse within the inpatient department, that is performing a data or history collection and physical examination. Next, we are going to see the third major important role related to the patient care for a nurse is assessing the data and making a plan of treatment. Now, nurses generally will be responsible to plan nursing care depending on the patient's physiological need. Even while planning the nursing care, psychological, social health also will be involved. Now we are going to see nurses also is responsible to implement those plans and evaluate the result of it. So generally, if a person or if a client is showing improvement, nurses would be performing the same nursing care plan for the client. But if it is not showing a proper improvement for the client, maybe they will be doing a reassessment of their medical need and replan the nursing care. So that is how the nurses are the responsible person to continuously monitoring the client, performing the physical examination for the client within the inpatient department, as well as plan the nursing care depending on the need of the patient. So the next role, which is included in a general role of a nurse within the inpatient department, as well as which is related to patient care, is definitely orientation of the hospital environment and protocols for the client. Now, it is a very important part of the whole procedures which will be occurring within the inpatient department and in healthcare facility. It helps the client to gain confidence regarding the medical care which will be provided within the healthcare facility to the patient, as well as it will be also helps to gain the confidence of the family member related to the healthcare facility. This orientation of a patient and family members will also helps to build the trust and interpersonal relationship within a hospital setup. So nurses here are the responsible person who will be orienting regarding the hospital or healthcare facilities protocol, their procedures, and even the physical environment for the client as well as their family members. Now, the next role of a nurse includes teaching regarding the treatment or medical treatment that has been planned for the client. So, generally, teaching would be done by a nurse to the client as well as to the family members related to the rationale behind the development of the medical treatment plan, rationale behind the development of nursing care plan, even the treatment that has been offered to the client. Even the policies and procedures, visiting hours related to the hospital stay, whatever the important information will be communicated to the patient and to the family member by a nurse. So it is a very important role of a nurse to communicate all the data to the client and their family member. So these are the roles comes under direct patient care, which will be ultimately helps to improve the quality of medical and nursing care, which will be or which is going to be provided to the client admitted in an inpatient department. The next, we're going to move on to the next role and responsibilities of the nurses who is present in an inpatient department. Now, this includes carrying out the clinical and nursing procedure, whatever has been prescribed by the doctor and whatever has been planned, and administration of medications or performing certain procedures which is indicated for the client, through which actually our client will be saved from the suffering. The next role definitely includes carrying out all the diagnostic procedures. So definitely within a hospital setup, basically within an inpatient care unit, we are going to see nurses are the major responsible person to carrying out all the necessary diagnostic procedures prescribed by a doctor, through which generally a medical diagnosis will be confirmed for the client. So within a hospital setup, even a nurse plays a very important role in infection control. So generally, we will be seeing that in an inpatient department when a person or when a client or patient is going to stay along with their family member, it is a role of a nurse to teach them regarding the safety procedures that has to be followed in order to maintain the hygienic environment around or surrounding them. So that is how nurses will be the responsible person to teach regarding the standardized protocols and safety measures. Even they will be taught regarding the hygienic practices that has to be maintained within a healthcare setup to reduce the chances of cross-contamination or spreading of infection. That is how a nurses here plays a very important role to promote a very desirable and healthful environment, which will be ultimately increasing the rate of recovery of the clients who are suffering within a hospital setting. So as we have learned various roles and responsibilities related to the direct patient care, now we are going to learn or discuss regarding the nurse's role basically as an advocate. So even in outpatient department, we have learned that nurses plays as an advocacy role here, who will be generally standing as a patient advocate, right? So even in inpatient department, we are going to see the nurses will be continuing to do so. So they will be basically called as patient advocate even within a clinical setup. So what are the role of an advocate for a nurse? We are going to learn it here. So as a nurse, the first and foremost important part here is to communicate properly and in detail regarding the treatment procedure and the treatment that has been planned for the client. Now, it is a nurse's role to ask the preferences from the client and the family member, as well as to involve the family member and client in the decision making while planning a treatment. So here, nurse will be doing the patient advocacy. They will be communicating about the patient preference references related to the medical treatment and procedures to the healthcare team members. So that is how, by being a patient advocate, a nurse ultimately will be improving the quality of care. Even this helps to improve the effectiveness of the medical care for the client. Now, the next role of a nurse includes the communication. So, as we have learned before, that the nurses here, basically in inpatient department, plays a very important role as a communicator. So, as you have learned that the patient will be admitted to the hospital setup, so definitely we need to create an environment which seems like a home, so that the healing of the client can be increased. So nurses here plays a very important role by communicating all the necessary details to the patient as well as to the family members related to the medical procedures and treatment plan, even the nursing plan that has been planned for the client. Not only to the client and client's family member, but also nurses here plays a very important role as a communicator to communicate with the other healthcare team members. So remember one thing, this is only a department of inpatient department where nurses will be always in contact with the patient compared to other healthcare workers. So it is a very important role of a nurse to communicate within the healthcare team members to ensure effective medical care. So it is a very effective method or way how accidents or certain incidents will be prevented by doing a proper communication. As well as we're going to see, the nurses will be actually increasing the rate of recovery for the client by increasing the effectiveness of the medical treatment by following a proper channel of communication between the clients, family members, as well as the other healthcare team members. So as we have learned regarding the communication, next we are going to learn about the next role of a nurse is the documentation. So as we have learned that documentation is a very important part of the whole medical treatment within a healthcare facility. It also basically stands or helps legal issues to solve it in the sides of medical professionals as well as in the patient side. So it is a nurse's role to maintain the documentation properly. So a proper documentation should definitely be ensured in each and every inpatient care unit. Now, documentation should include the patient identification, their history, their physical examination or the findings of physical examination. Even proper documentation should be done by the nurse regarding the diagnostic procedures that has been done or performed for the client, even their findings. Even a proper documentation of the medical diagnosis has to be made by a nurse within our inpatient care unit. Now, it is also responsibility of a nurse to maintain a chart related to the administration of the medications, related to the procedure that are being performed by a nurse for the client, as well as their activity or their improvement or deterioration of the health within the inpatient care unit. So nurses here plays a very important role to maintain the adequate documentation in order to communicate in a very well manner. So that's how we are going to see the nurses here plays a very important role to maintain this particular work of documentation within the inpatient care unit. Not only that, even nurses will be documenting regarding the treatment plan, the nursing care that has been planned and implemented, and also the evaluation of it. So that is how it is going to be so effective if a nurse is maintaining a very effective and clear and precise documentation regarding the patient care. Next, we're going to learn regarding the next role of a nurse within an inpatient care unit, that is educating the client. So it is a very important role of us to educate the client related to their factors affecting their health. So, what are the education, or what are the particular a part of education our nurses will be generally providing to the client in an inpatient care unit? Let us discuss that. So we'll start from the initial phase. So once I have mentioned that the nurses are the responsible person to educate the client initially regarding the hospital policies, the policies related to the stay within the hospital, even the discharge policies. So it is also a nurse's role to discuss the probable treatment plan or the planned diagnostic procedure that would be going or that would be performed for the client in order to conclude the diagnosis for the patient. So here the nurses will be discussing regarding the detail of the planned treatment procedure, diagnostic procedure with the client and the family member. So here educating the client regarding the rationale behind the treatment plan and the diagnostic procedures that is being planned is very important to make sure that the client is agreeing to the medical treatment, what is needed for them. Also, here we are going to see the nurses will be educating the client and also the caregiver regarding their lifestyle modification that need to be done once they are suffering from any particular disease. Also, nurses will be teaching regarding the very minute factors related to health that includes everything related to your lifestyle, your diet pattern, your exercise pattern, your daily habits. Nurses here also will be encouraging to the client to shift to a more healthier lifestyle. Also, it is a role of a nurse to educate the client and the caregiver about the effectiveness of the lifestyle modification. Next, we are definitely going to see a nurse will be teaching the client related to the adherence to the medical regimen. Even they will be teaching and counseling the client and caregiver related to the importance of the follow-up and a regular health checkup in order to prevent the disease condition progression or development of complication. So that is how we are going to see the nurses will be educating the client as well as their caregiver regarding all the important points that is related to their health, disease, and the treatment. Even sometimes in inpatient care unit, nurses will be acting as a very important role to educate the client regarding the disease condition, regarding the medical treatment and the surgical treatment that is being planned for them. So it is a very important role of a nurse to make sure that the patient and the caregiver are having enough confidence and they have able to build a proper trust over the medical team and the healthcare facility to provide effective medical care to manage the disease condition. Now, the next role of a nurse includes as a counselor. So, it is one of the most important role of a nurse, right? So, as we have mentioned, a client may require a prolonged stay within the hospital depending on their disease condition or health status. Now, generally, we are going to see because of many issues like social issues, family issues, even economic issues, the client or the patient is more likely to face some psychological challenges within the inpatient care department. Even the caregiver of the patient will be also in a different psychological state. So it is a very important part of a nurse's job to make sure that the clients are psychologically maintaining the well-being. As well as we are going to see the nurses here plays a very important role as a counselor by assisting and guiding the client in decision making related to the treatment that has been planned for them. Also, the nurses will be counseling the family members in order to provide maximum support and in order to provide maximum resources that is available within the environment. So it is also a role of a nurse as a counselor to make sure that the client is well aware regarding the available resources and they are using or utilizing it in maximal way so that the treatment would be having a very great effectiveness within the clinical setup and which will be ultimately promoting the rate of the recovery. So that is how nurses will be playing a very important role as a counselor to provide a very effective nursing and medical care to the client and to the family member within our inpatient care unit. So the next role is a very important role of a nurse is a role of a manager. So not only a nurses will be providing a direct patient care or they will be just managing the medical treatment or nursing care treatments, but we're gonna see also the nurses here will be playing as a major role as a manager who will be involved in the planning, organizing, directing and controlling all the job or all the responsibilities related to the nursing facility. So we're going to see the nurse in charge will be basically act as a manager to manage a particular inpatient care unit in order to provide a very effective medical care and nursing care as well as to maintain a healthier environment which will be ultimately promoting the recovery of the client within inpatient care unit. So as we have learned the role of a nurse as a manager, now we are going to learn regarding the another role of a nurse, which is role of a motivator. So we're going to see the nurses here have a very essential role to play to motivate the client to adopt a very healthier lifestyle. So generally, often our client is seen to neglect their health once they are having any disease condition. So it is a very important part of our nursing job to make them understand to adopt a more healthier lifestyle so that the complication and the disease progression can be prevented. Changes in the lifestyle, their habits in a positive way definitely will be affecting the client's physical, psychological, social well-being. So nurses here plays a very important role to motivate the client to move on to a positive way of life as well as it is a very important role of a nurse to motivate the family member in order to provide all the available resources to the client in order to make sure that the client is receiving adequate social and familial support to ensure a early recovery. So the next role includes role of a critical thinker. Critical thinking is a very great part of nursing. So we are going to see the critical thinking helps the nurses to solve many issues within the clinical setups associated with the medical and nursing treatment and client, and also it is helps a nurse to adopt a practice to manage with the available resources and to manage the any emergency which is occurring within the healthcare setup. Now, also we are going to see helping the client to promote their health also will be done by a nurse through doing a critical thinking. So it is also a very important role of a nurse to act as a critical thinker in an inpatient care unit. So the next role of a nurse is role of a researcher. So as we have mentioned before that nurses will be continuously collecting the data to improve the nursing practice as well as to improve the effectiveness of the medical care. So it is an important role of a nurse to collect data at a regular interval. Even providing the information which is evidence-based practice often will be helping the nurse to improve the quality of their practice, which will be ultimately improving the medical facility and the medical care offered to the patient within our inpatient care unit. So as we have seen, the nurses will be playing a very important role as a researcher. Next, we're going to see nurses also will be having a very important role providing bedside care. So all the necessary care will be provided to the client in a bedside. So definitely it helps to improve the health of a client. It also helps to ensure that the client is having a proper rest and sleep, and they're maintaining a very good and healthier lifestyle. That is how we're going to see the effective bedside care will be ensured by a nurse in inpatient care unit to improve the quality of life and for early discharge and a very prompt recovery of the client. The next role is training and educating. So, as we have learned in inpatient care unit, the education, training, and research will be continuously done by a nurse. So we are going to see the nurses will be playing here a very important role to train the new faculties or the new nurses, as well as educating the student regarding the disease process, regarding the treatment and their rationale that has been planned, and also the rationale behind the nursing care plan that has been planned for the client, through which the improvement of the quality of the medical care will be done in inpatient care unit. So it is also a role of a nurse to educate and train the junior staff in order to make sure that they are having a good practical knowledge and a good quality where they can provide a very high quality medical and nursing care to the clients. The next role of a nurse is definitely maintaining the inventory within the inpatient care department. So they are the responsible person to manage the inventories, to make sure that all the necessary equipments, the necessary drugs, emergency equipments and drugs are readily available within the inpatient care unit in order to manage any emergency or to meet the need or physiological or medical need of a client. So I hope till here we have discussed regarding all the details of a nurse and their role in inpatient care unit. So I hope you got an idea how inpatient department and outpatient department will be working in a hospital setup and what are the role and responsibilities of the nurses. So whenever we are going to get into a clinical setup, these are the points that has to be kept in mind in order to improve the quality of nursing care and also to ensure that the client is receiving the maximum highest quality of nursing and medical care, and also to ensure that the client is achieving a very high rate of recovery. So I hope you have enjoyed the session very much. Thank you so much for attending this one. We will be meeting you guys in the next one.